my husband, Dipanjan Bhattacharjee, we came to Manipal Hospital at the beginning of this month, particularly for a very complex surgery. He underwent a very critical brain surgery in this hospital under Dr. Sampath Chandra. There was a team of doctors who was operating under the leadership of Dr. Chandra.
I am Dr. Sampath Chandra Prasad Rao. I'm a skull-based surgeon, head and neck onco-surgeon and a cochlear implant surgeon working at Manipal Hospital, Bangalore. This particular patient was unique in many ways. This patient came to me with a prior history of surgery and when we scanned him, we realized that there was a close to a 6 centimeter tumor which was most likely to be a meningioma involving multiple compartments in the skull base. So this tumor had gone into the petrous bone, into the brain, into the intracranial cavity, into what we call the infratemporal fossa, which is the portion behind the eyes and between the ears, and also the jugular foramen, which is again a very, very critical part of the face or the skull base. So this patient was operated a few years back and subsequently he developed a facial nerve paralysis. One half of his face was paralytic and that was quite obvious. He also lost his hearing, and when I had a look at the scans, we realized that it was a challenging case to take up for surgery. But since there were other comorbid conditions like increased intracranial pressure, we had to do something for the patient. So we decided to take up this case as a challenge because he was a young man and a very successful lawyer by profession. So we took up this patient for surgery and we planned a complete resection using a transtemporal approach, which is a skull-based approach using the space behind the ear and around the ear. And we went in and we took out the tumor entirely, and we also could achieve simultaneous facial nerve reanimation, and the icing on the cake was we also put in an implant in the same area to restore his hearing. So towards the end, what we could achieve is complete total tumor excision, which was considered inoperable elsewhere, but also restoration of the facial nerve function and hearing restoration as well. The entire procedure took close to 36 hours and it was a series of teams coming in one after the other like a relay, like a marathon relay, and each one put our best foot forward and we could give the patient a very, very satisfactory result.
Subsequently, we got involved in the surgery where the intracranial portion of the tumor was excised through a translabyrinthine approach, and we decompressed the tumor sufficiently. The tumor was quite vascular, quite fibrous, and it was encasing the critical nerves in that area. The fifth nerve, which provides sensation to the face, the lower cranial nerves, which are involved in swallowing, and also obviously the facial nerve had been involved. Also, the tumor was adherent to the brain stem, which is a critical area of the brain. So we were careful in debulking the tumor and excising this tumor. We achieved a good decompression of the tumor.
We tried a lot of medication and meditation, and but after talking to Dr. Sampath Chandra at the beginning of the month, we kind of gained the confidence that we could go for a second surgery, and we did go for it.
Following the resection of this very, very massive tumor, almost after 24 hours into the surgery, me and my team were called to reconstruct the facial nerve. So what we did is something unique which not many people in the world do. That is to use a crossed facial nerve graft. That means we borrow a nerve from the opposite side and then connect it to the damaged side. Now this is done by using a nerve graft from the leg, and we used a unique tube-in-tube method wherein the nerve graft floats inside the tube and we are able to pull the nerve from one side of the face to the other without making any external incisions on the face.
When we talk about precision, we are talking about doing just enough without taking away anything. So this basically means reanimating the affected side of the face without affecting the normal side of the face. The best part and the icing on the cake was once the patient recovered after the 36-hour procedure, we were able to check his normal side and it was completely unaffected. He was able to smile, talk without any problems.
So managing an anesthesia of this major surgery, which was for extended duration and a complex one, was quite challenging for the anesthetist. 6-member team of anesthesiologists headed by Dr. Murthy. Patient remained stable throughout the surgery, and we could immediately wake up the patient once the surgery was over.
This patient subsequently underwent a osseous switch on, which is a implant switch on, and he regained his hearing back after the surgery.
Thank you, Manipal team, for the amazing service that they gave. And one more thing, every other medical team was always highlighting the risk. They highlighted the solution to us. We are really grateful to this entire team of Manipal, and it was a rebirth for both of us. Thank you.
Yeah, thanks a lot. Again, like the team rocks, we were feeling very special. So thank you for doing this for us, and this is definitely a second innings. Thank you.